Hello, my name is Gemma Yepes. I'm going to talk about reduction in late mortality among 5-year survivors of childhood cancer. The Childhood Cancer Survivor Study has assembled the largest cohort to date for assessment of late mortality. 5-year survival rates for most childhood cancers have improved significantly over the past 4 decades. In the modern era of cancer treatment, more than 80% of children diagnosed with a pediatric malignancy will become 5-year survivors of their cancer, due largely to the use of advanced diagnostic modalities and improvements in surgical and radiation therapy techniques, combination chemotherapy, and supportive care.
Over 83% of children diagnosed with a cancer will become 5-year survivors of their cancer. However, as we've followed those survivors across their lifespan, we've learned that they remain at risk for second and third cancers down the road, higher risk than the general population, and it's all because of the therapy that they received to beat their first cancer. We've worked now for several decades to lower radiotherapy and chemotherapy doses for standard risk populations. This study now shows that those reductions in therapy have reduced risk for second and third cancers, such as breast cancer, meningioma, skin cancer. That's great news for survivors who want to live a long lifespan.
Application in medicine. Cancer in children can occur anywhere in the body, including the blood and lymph node system, brain and spinal cord, kidneys, and other organs and tissues. Cancer begins when healthy cells change and grow out of control. In most types of cancer, these cells form a mass called a tumor. A tumor can be cancerous or benign. A cancerous tumor is malignant, meaning it can grow and spread to other parts of the body. A benign tumor means the tumor can grow but will not spread to distant parts of the body.
We don't really know why children develop cancers in different tissues of their bodies. It's something that we're still trying to understand. We do know of some genetic changes that allow cancers to form in certain tissues. So, for example, there are some children who have inherited tumors of the eye, and we know about the genetic change that causes that. But for the most part, we don't really understand very well why one cell in one tissue starts to grow in an uncontrolled way. And so again, this is kind of one of the mysteries of this, is why this happens. We do know, that certain ages of children, children of certain ages tend to develop certain cancers, and then that risk goes away with time. And so there's probably something about growth and development that also affects this. But there's a lot more that we don't understand.
Pros and cons. You should have a follow-up care and intensive medical supervision for the rest of their lives because of the risk of complication that can occur many years after completing cancer treatment. Survivors of any kind of cancer can develop health problems months or years after cancer treatment, known as late effects. But late effects are of particular concern for childhood cancer survivors because treatment of children can lead to profound, lasting physical and emotional effects. Late effects vary with the type of cancer, the child's age, the type of treatment, and other factors.
Children live the life of dreamers, but in a heartbeat, all that can change. Every 2 minutes, a parent somewhere in the world hears, "Your child has cancer." These 4 words change everything. Parents' time is torn between hospital, home, and work. Brothers and sisters feel left out and left behind. The child with cancer misses out on school and spending time with friends. Treatment takes over their life. The child is poked, prodded, and exposed to harmful radiation. Harsh chemicals are injected into their bodies. They lose their hair, eyelashes, eyebrows, limbs are removed, organs are cut out. The path to survival is a brutal, dangerous road. And sometimes, cancer does have the last word. 1 in 5 children diagnosed with cancer in the US and Canada will not survive. But for those who do, the battle is still not over. 2 out of 3 survivors will develop long-term effects from the very treatment that saved their life. Things like learning disabilities, hearing loss, heart disease, infertility, even secondary cancers. It's a nightmare, and every 2 minutes, it starts again. But it doesn't have to be this way. Researchers around the world have brilliant ideas to change the course of childhood cancers forever. Smart medicines that target only the cancer and don't poison the rest of the body. Treatments personalized for each child's unique genetic makeup, not a one-size-fits-all. Early detection and even prevention, finding and stopping the cancer before it attacks. But the only way to make this possible is to fund research. That's where you come in. When you make a donation to the St. Baldrick's Foundation, you fund the very best childhood cancer research in the world. Treatments developed in a bustling city will help a child in a small town. Revolutionary research in one country will fuel breakthroughs in another. It's a ripple effect that will change the world. Children with cancer will have safer, less painful, and more effective treatments. Parents will plan birthdays instead of a funeral. Brothers and sisters will have their family back. The child with cancer will go to school, grow up healthy, fall in love, start a family of their own, and do great things. Childhood cancer is a nightmare, but you can fund the research that will conquer it. Join us.
Issue played in Ecuador. When examining the variables of sex and age, we realize that there are more male patients than female, and that the ages that are more frequent among these patients are those under 5 years, which constitute 51.9% of the total population.
The current research project is really groundbreaking in the fact that with using our St. Jude Lifetime cohort, we have been able to conduct detailed genetic analyses. And in these analyses, we've found that a substantial proportion, about 12% of the patients, have a mutation in a gene that's been associated with cancer risk. What this means for our patient population is that we can now define those individuals even more precisely in terms of who is at high risk, who needs to be referred to their appropriate healthcare providers for screening, genetic counseling, to really provide them with an informed approach to bettering their health in the future.
Conclusion. Survivors of childhood cancer need follow-up care and enhanced medical surveillance for the rest of their life because of the risk of death. With advances in therapeutic strategies each time, more children and adolescents survive cancer. However, it is crucial to assess the late effects of new plans and its treatment and adopt the future therapies.
Happy birthday to you. Keep going. Do them all.
We'll need to do an MRI, X-ray, and some more blood work.
You did so good.
Fortunately, it is simple.
Wait, I'm gonna jump in.
Children's Cancer Research Fund supports the best and brightest scientists whose ideas make the greatest impact for children with cancer. Together, we're improving the way families experience treatment and life afterward. A world without childhood cancer is possible, but only with your help.